What?
Okay, Senate Health and Welfare, we are back and we are taking up H279, which is a housekeeping bill, we're hoping, from Department of Vermont Health Access. So Jen, thanks for being here with us.
Sure.
And why don't you just walk us through the bill, and then we'll hear from folks from AHS after that.
Great. Good morning, Jennifer Harvey, Office of Legislative Counsel. So we are looking at H279, an act relating to miscellaneous changes affecting the duties of the Department of Vermont Health Access. Section 1, and I'm sure you will hear more about the rationale behind some of these changes from the DVA and AHS folks, but Section 1 makes a change in the statute on Medicaid coverage for adult dental services and in the requirement of what Vermont Medicaid must cover. It strikes out up to 2 visits per calendar year for preventive services and replaces it with just general coverage for preventive services. And my understanding was that it was, I think, difficult from an operationalizing standpoint and computer system standpoint to do the 2 visits per year limit. So it is all medically necessary dental services, and that includes preventive services, including prophylaxis and fluoride treatment.
Go ahead. Asking about this because this was one of my first bills.
I know.
So would this, do you feel like this is more limiting or more expansive or the
I
same?
think it's potentially more expansive because
Okay.
there isn't a visit limit. So it's prophylaxis and fluoride treatment. So whatever is required for prophylactic treatment for preventive treatment for a Medicaid beneficiary, I think would be covered. But you can ask the DVA folks. It was their proposal.
Okay, and where is the language? Oh, I see, and the shall provide coverage for medically necessary dental services. I see that, that's section 8. Okay, okay, I will ask them as well.
Go
Thank
ahead,
you.
Senator Pearl.
Thank you, but there's still nothing in here about dentistry.
There is nothing in, is not changing the, what is covered under the Medicaid dental benefit. Section 2, and actually really sections 2 and 3 kind of clean up and consolidate the provisions around the pharmacy best practices and cost control program in Medicaid. So right now there are separate reporting requirements, annual reporting requirements on prescription drug programs, and has some language on a rule to be proposed in the prescription drug program that was a requirement years ago, and that draft rule will be presented to a committee that doesn't exist anymore. So some of this is just cleanup changes within the prescription drug programming, and as I said, consolidating the report requirements into one single report instead of separate report requirements. Section 4 is something that will look familiar, at least to Senator Hardy. This language has been in a number of different bills, and it is around whether to have separate health insurance markets in plan year 2023 for the individual and small group market, depending on what happens with federal advanced premium tax credits. So I think this language is being looked at in most detail at down the hall in the Finance Committee in the context of a DFR housekeeping bill. But it is in here as well. So I think at some point a decision will need to be made both about how to address the issue, but also which bill it should live in. I think it's in 2 or 3 different ones.
Yeah,
Double dose.
it's a zombie provision. Just like
So, and I'm happy to talk more about that if you want, or you can leave that to the committee down the hall. But this was one of the places it was put in to preserve the issue coming over from the House.
Well, we'll hear from DVA and then we'll let it wander down the hall.
Yeah,
Yeah.
I think coordinating with the
Yeah,
other
right,
chair
good,
is
yeah.
helpful.
Taking it
yeah,
up
so
again on
Senator
Thursday.
Cummings is not here right now. She had a meeting she couldn't avoid, and so.
Yep. So it is being taken up again in finance on Thursday.
Yeah. Okay.
I can't wait.
You get it all.
Some people are just crazy, right? Sitting right here. Okay.
So, and that would take effect on passage. So it is yes, it is a minimally substantive bill, other than, that insurance provision that,
Right, so
Likely
that,
will
and
not
that's
stand.
the section
and
four,
that's section 4.
section four insurance provision that we're gonna let Ruth and Ann take care of. Okay, any questions for Jen? Why don't I ask Representative Page a question? So in the committee process, was there anything that, you think we should be hearing further from folks outside of DEVA? In terms of, anything that was more controversial here, knowing that for us and this side of the fence, the insurance coverage piece will be going down the hall to finance.
Representative Whitman Page, I don't believe there's anything controversial in this bill. I will remind you, this is the second time that I've reported the bill on the floor. First time due to pandemic situation that didn't go forward. I will add that our vote in our committee was 902. So those that were there were in complete agreement with the bill.
And then on the floor, it was a voice vote.
It was a voice vote, and it obviously passed.
Terrific, thank you. That's very helpful. That's good. So, questions for Jen or Representative Page? We're good. Why don't we move to DEVA, and Addie, you are here. Thank you for being here. And do we have anything from you? No, not yet. So why don't you just, which may not be necessary given what's here for us. So why don't you go ahead and provide your testimony, and then we'll hear from Ina Backus as well.
Thanks very much. This is Addie Stromolo, Deputy Commissioner from the Department of Vermont Health Access. Thanks for having me. And I think Jen did a helpful walkthrough of our housekeeping bill. It's funny because several of these sections were introduced back in 2020, and then we all kind of moved into pandemic response mode. So it's been a while since we've spoke about them. But as Jen described, the first 3 sections we do consider to be in the housekeeping realm. Section 4 is obviously more substantive. But just to quickly address a few things in those first few sections, with respect to section 1, this, as Jen described, is cleanup because our understanding is that the provision of 2 preventive visits outside the cap was not meant to be to the exclusion of additional visits if medically necessary. And both from an implementation perspective in our system and also from a federal kind of approval perspective, we weren't able to cap those 2 additional visits outside the cap and then also allow for medically necessary additional visits. So we thought this was more in keeping with both the policy and the practice. And I hope that gets at your question, Senator Hardy, but happy to take it back if not.
Yeah, it could potentially provide more preventative services than the limit for 2. Is that?
Exactly.
Okay, yeah, that's good. That's what I wanted to make sure. I didn't want it to be, more generous than less generous than what was in there originally. So thank you.
Sure thing. Then for sections 2 and 3, again, this is essentially kind of updating and consolidating part of the pharmaceutical benefit statute, just generally to reflect that those pharmacy best practices and cost control programs are now well established and kind of part of our day-to-day work. So this would eliminate some duplicative reporting with respect to just legislative reports as well as rulemaking. And unify everything under our annual report, which covers all of the items listed. So utilization review, preferred drug list, prior authorization, pharmaceutical assistance program. And we think that would be a more efficient way of getting that information to you on a yearly basis. So with respect to section 4, as you heard, this was added in the House and has to do with the structure of the individual and small group health insurance market. As has been mentioned, this is a policy issue that's under discussion in Senate Finance. And we, I think, largely would like to kind of defer the policy discussion there. But I can just walk through the specific language as it exists in our bill, and some considerations for the committee, if that would be helpful and we have time. Happy to do that.
Why don't you just take a minute or two to give us the 2,000-foot?
Sure. Okay, so just by way of background, and I think you all kind of have this, the insurance market traditionally has been merged in Vermont, pure community rating, same plans and same rates across the individual and small group market. For 2022, the General Assembly voted to unmerge the market for 1 year. And the effect of that is that insurance premiums increased less than they otherwise would have for the small businesses and more than they otherwise would have for the individuals. So at baseline, good for small businesses, bad for individuals. But that individual increase was offset by the availability of expanded subsidies under the American Rescue Plan Act. So just as a refresher, that's a bill that was passed last March of 2021 that dramatically expanded the ACA subsidies for premium assistance, and Vermonters are benefiting from that today. But under current law, those subsidies will sunset at the end of 2022. So the language in Section 4 would keep the market unmerged for 2023, but only if those subsidies are extended by September 1st. So when this language was added in the House, we provided feedback that September 1st date is really not workable. And I can explain a little bit about that. It has to do with the administrative process that's necessary on the federal level. Essentially, while this may seem like a relatively easy policy change on the state level, there is substantial federal process. We work with our colleagues at DFR to submit actuarial justification, multiple forms, and it's not something that CMS really undertakes with any regularity. It's kind of usually a very fundamental policy shift for a state to ask CMS to approve something like this. That said, we were clear with CMS about the kind of dependency on the availability of subsidies, and we did have a discussion with them about whether we could remerge this year if the subsidies are not extended. And while I think they did say it was possible, but the timing would have to be earlier than is in this bill. It would have to be in early August. So that would cut an additional month during which Congress could act to extend those subsidies. And I think it's important to note that I'm just not sure CMS would have an appetite to revisit this again if we remerged and then the subsidies came back and we wanted to unmerge again. So, and this is a lot. Is this confusing everyone?
This is great, but it is a conundrum.
Yeah, it's a tough one, but I think where we're landing by way of recommendation would be to remove that date dependency from the language, and simply leave the markets unmerged for the 2023 plan year. So essentially extend our pilot of unmerging for 1 more year. And that would allow maximum time for Congress to act to extend those subsidies, which we believe is really the most important thing for market stability. I think that would also give the state more time to look at the market structure longer term, and make some recommendations, especially once we have more of an understanding of the future of the ARPA subsidies. So again, our colleague Sean is planning to walk through some more specific scenarios and numbers in Senate Finance this week, but that's the kind of overall recommendation with respect to this language.
Thank you. That's very helpful, and we will. This is an issue that was debated and completed in Senate Finance, so it's there. What?
This is the market.
What did I do now?
Merging
The
and
small
unmerging
group
market.
market, yes,
That's
Yeah.
this week, once we get through taxes.
Yeah, it's in this bill, so that's why it came up.
It's in the bill, and we'll have a conversation about where it is with finance and so on, the process. So where Health Reform Director Ina Backus is with us, and just want to say thank you, Deputy Commissioner. That was very, everything that you helped, that you presented was very helpful. Appreciate it. Ina, welcome.
Thank you, and thank you for providing me the opportunity. Since the issue that Deputy Commissioner Stromolo just discussed with you is one that you're going to be following through via the Senate Finance Committee, I don't think I have anything substantive to add here. I'd certainly welcome questions if there were further questions about the marketplace composition in particular, but if there are not, then I'm happy to have heard Commissioner Stromolo's testimony and to have had the opportunity to answer any questions.
Okay, well, we won't dive into section 4 any more than we already have, but there may be other questions. So, I guess not. This is terrific, very helpful. The committee hasn't made any suggestions around proposals of amendment to the bill. And certainly the section 4, any proposal there would be completed in Senate Finance. So I think we're good at this point. All right, thank you. That's great. Representative Page, you've done a good job.
Oh, thank you.
Thank you.
Am I dismissed?
You are, but I will say this, that depending on how the bill goes forward, if section 4 stays in or is out, and then what happens to it, as well as other parts of the bill, please know that we'll stay connected with you, and whoever reports the bill may want to talk with you further. So thank you.
Okay, thank you very much.
All right.
Have a good day, everyone.
You too.
Okay.
Josh, you didn't have, Senator Terenzini, did you have any questions?
I'm all set, Senator Lyons. Thank you. I'm listening as best I can. I'm having some bandwidth issues.
Yeah, that Aaron let us know, so we know you're there.
Thank you.
Okay, so I think what we're going to do is to move on to H703. And I spent some time going through the bill, and we all have the hard copy of the bill, as well as the summary of the sections. And if we can just, why don't we just take a minute to get our material? I don't have to take a minute to get my material. So Jen, we have all the sections that you drafted. I spent some time, so the sections that I looked at, that you have drafted, I think, or Katie drafted, were sections 20 through 22, 25, 27, 28, and 29, 32, 34, and then Katie was on 38.
Okay, so I drafted sections 19 through through 36.
Okay. Oh, I was looking at the ones that had money in them, I guess.
Oh, okay.
Okay, I'm gonna go back and so this is gonna get a little messy because we've each gone through independently and we have a lot of comments to make. So here's what I'm gonna ask. I think I'd like to ask if there are general comments that committee members would like to make. I've got some that I think are important, and then everybody can just agree with me. And then we'll go through what we have here and make, we'll go through and make comments as we go. But overall, I just want to say, I did meet with AHEC, the Area Health Education Group, And the work that they do is pretty comprehensive across the state in terms of the loan repayment type programs. And they have huge experience in administration of those programs. So as I went through the different sections of the bill, I noticed that there are loan repayment that's given to VSAC and loan repayment that's given here and there related to healthcare. And AHEC is specifically has worked since 1997 for many years on this whole area. I'm trying to think about how we could think about us putting in place a recommendation for statewide loan repayment system based on and strategic use of funds based on what AHEC currently does. They because they have a very low administrative their overhead is.
Where are they? Are they part of?
Well, they're located at the University of Vermont Medical College. And they have, they are in the northern part of the state, the central part of the state.
Now, are they a state agency? Are they?
They're federally.
They're federally,
Okay.
created.
federally created, and we have funded them and worked with them for years, and I've got all their,
Okay.
you may have their information as well. But, so anyway, to think about some comprehensive systematic strategies for loan repayment, and then similarly, VSAC has huge responsibilities and work that VSAC has done on loan forgiveness, which is different. So one is incentive based and the other is helping people who are already working. So I've been thinking about that a lot, and then how to put some of this together. The other thing that I noticed as I went through was there are a lot of there's a lot of nursing in here, but there's not a lot of mental health support. There is some of that is in education, so I get 2 cracks at this, but we have identified in the past and continuing mental health social workers who are needed, mental health counselors and others. And that's why I asked the question of Senator Kitchell today, because there is language in the budget on mental health, but I guess apparently all the money is here. So I'm trying to sort out how we bring those 2 together, and I haven't done that yet. So I'm gonna go back and do that tonight. There's no other time.
I think the money's actually in H
It looked like-
159.
Yeah.
Right now it's about 29 million, I believe.
703, we have, and we can't go above $12.9 million in this bill.
For healthcare, for our area,
For this bill.
12.9.
I added it all up, and I think I might have added properly, but, I did it in my head. Okay, so Jen.
Yes.
Oh, there's also a section on early childhood, section 17 and 18, which I think David Hall might have.
It's just language.
It is, it's just
Intent
findings and
language.
intent, and I don't know why it's there.
It seems an odd place for it, but I think it might have been
It was
from,
for the Head Start, I think.
I think it might have been the findings and intent language that was in the big childcare bill that we did last year that got taken out. So the House put it in here
Oh,
because the Senate took it out.
you're right.
I'm pretty sure that's what
You're
it
right.
is. But Katie would know.
Yeah, so we'll deal with
Drop that right, yeah.
No, we'll deal with that separately, but just, it is there. Okay, so Jen, what is your suggestion here to help us?
It may make sense to at least walk through based on the section by section. We can look in more detail at anything that you want.
Okay,
And it may also be useful for you to hear from someone from the House if you have questions about why things were done a particular way.
If we have time, I mean, we're supposed to have this all done by Thursday, possibly Friday at the latest. But I'm gonna have to scream for more time because we definitely, this is a big set of decisions here. Okay, why don't you go ahead? We have two things. We've got the section by section and we have the bill
Yep,
itself.
that's great. So I'm probably gonna, I mean, I'll flip through both of them, but I'll probably focus mostly on this section by section.
Okay, so let's find what page section 19 begins on the
Page
bill.
7, yep, and in the draft, it's page, or in the bill, it's page 33. If you're looking at the language as well.
It's actually kind of fun to go through this, but then it was also frustrating. So much here. Okay,
So section 19 starts off the workforce sections with some legislative intent around recruiting and retaining healthcare workers in Vermont by reinforcing the current workforce and sustaining workers into the future. It talks about the intent of General Assembly to invest in multiple solutions.
can I make a comment right there? Was there any discussion that we know about, or maybe we should add something about not, I hate to be negative, but less reliance on travelers? There's nothing in there on that. And that it seems to me that travelers has exacerbated budget problems. But anyway, just think about it.
maybe in a more not negative way,
Yeah.
just to say that the pandemic and the shortage have caused a heavier reliance.
Oh, thank you. That's very good. That's good. Great. Okay. Go ahead.
Write that down. Okay. The section 20 is emergency grants to support nurse faculty and staff, and this appropriates. So they have been using the term nurse educators. I guess I haven't updated this since, but
So this is about retention. It's not about adding new.
at the moment, I mean, this piece of it, there's other stuff about adding new, but this one is just supporting the ones who are currently there. I suppose it could also be to encourage new ones, but it's based on numbers of existing staff. So this would appropriate 3 million in ARPA funds to the health department and carry it over so that it would have grants for 3 years to increase compensation for nurse faculty and staff. So it would be $1 million each in fiscal years 2023, 24, and 25. For both clinical and didactic nurse faculty and staff. Some of them are practical in the clinic setting and some of them are in the classroom setting. And we have the department distributing the funds among nursing schools equitably based on their kind of what proportion of the state's overall nursing faculty and staff that school provides.
Okay, so we're gonna have, I think, as we go through each section and subsection, because I'm gonna have a comment, and Senator Hardy has a question or comment, so go ahead.
I just, in general, sort of for all these sections, when we say, or when it says nurse, is that the generic term for nurse? Does it include LNAs, RNs, and nurse practitioners, or is there a distinction made anywhere?
I think in a later section, you will see where it's codifying a nurse scholarship program, an existing nurse scholarship program. It spells it out, and there may be other places where it specifically spells it out. But in this case, we're really looking for people who are educating nurses. So, which I believe requires being a nurse oneself. So I'm not sure that the nurse faculty includes all levels of nursing. It's whoever is qualified to be nurse faculty, but as far as who they are educating, yes, I think it's all.
Everybody, okay. So unless it's specifically spelled out, it's
It's,
Yeah,
I think it's,
presumed to be
yes, I
general
think it's
and
presumed to be
every
all
kind of
levels,
nurse.
all
Okay.
levels of nurse.
Yeah, and as you go through, you'll see places where it looks like, oh, that's an LPN, that could be an LPN, or is that someone, at what level? So,
Yeah.
yeah,
Right, so I'm not sure that LNA is included, because I don't think,
yeah.
I think that's a different, different kind of certification.
LPN,
But LPN, RN, and,
But
nurse
this-
practitioner, APRN.
The CTE section may have the LNAs. so-
Yeah, and I think there's some,
Yeah,
excuse me, I think there's some thought in certain places in the pipeline section about kind of,
yeah, yeah.
educating people up to the next level or
Right.
to higher levels, yeah, which would apply to people at the LNA level.
And I'm just curious about, what is this universe of educators and how many, are we looking at? If we're looking at a couple of the nursing programs at Castleton, at
NVU,
NVU.
UVM,
Norwich.
Norwich, yeah.
Yep, so I think those are the ones at the Vermont State College and CC, or Vermont Technical College. So there's the Vermont State Colleges, UVM, and Norwich.
Then there's another whole field that isn't mentioned in here, and that is laboratory. And laboratory medicine right now is in significant need, but nobody's talking about it because tests get sent all over the place. But anyway, we'll come back to that.
It just makes me wonder about the amount of money that we're looking to appropriate and the amount of need, the need.
Right.
That's exactly my question.
Okay.
Okay, subsection B, you'll see this in a couple of other places in here as well, are just recognizing that in some cases, nurse faculty and staff may be under a collective bargaining agreement, and so how this additional funding would be rolled out in a collective bargaining sense, and that would just be as impact bargaining.
So just want to reinforce, that this is about keeping people who are already there. We don't know whether or not the salary is something that's going to hold them. And we do know that we need more PhD nursing to expand offerings at school. So but it's not here. It's not here. There's nothing about new.
Well, there is about new later.
Yeah.
Because there are, I believe there's a nurse educator forgivable loan and loan repayment program, where they changed some of the terminology as it went through the process, but
Okay.
that's coming up on 2 pages. Section 21 is providing incentive grants to nurse preceptors. These are for hospital employed nurses in Vermont to serve as preceptors for nursing students in Vermont's nursing school programs. And this would have the Agency of Human Services distributing its $2.4 million to hospitals employing nurses who provide nurse preceptor supervision based on the number of preceptor hours to be provided at a rate of $5 per preceptor hour, or a lesser amount if there's more need than there is funding. So this is something that currently there is typically not additional pay provided to these nurses to act as preceptors, and so this is to encourage more nurses to be preceptors.
Where there's no, yeah, so thinking about this, sort of the clinical placement opportunities across a variety, this is on page 35, big A, for nursing students enrolled in Vermont nursing programs. So we talked about here, it was one of the questions that I guess I asked, I don't know where I asked it, anyway, the use of telehealth, telecommunications in expanding clinical opportunities. So that's not mentioned in here, but I'm just gonna, I think maybe we could put something in here that would suggest as they go forward to look at clinical access for preceptorship and students, student interns, clinical participants, so we could say something about utilization of telehealth.
I think that would have to be a floor amendment, right? This is a bill.
Well, we're gonna take our comments into economic development, so we don't, hopefully we don't have to do a floor amendment.
Well, they will. I mean, somebody's gonna have to amend the bill.
Well, they will.
Yeah.
And we can make recommendations about So if that's something, just keep that. Okay,
Okay, and I'll mention that in a second here. So then we're looking now so the top of page 35 was the same collective bargaining language that was on the last incentive program. And then subsection B is it's a working group of stakeholders representing nursing schools, long-term care facilities, the DAs and SSAs, FQHCs, home health agencies, primary care practices, and other healthcare facilities to look at ways to increase clinical placement opportunities across a variety of healthcare settings for Vermont's nursing students. So we could add something about telehealth there. Is that what you're?
yeah, I think so. I mean, we're not telling them to do it, but it offers some opportunities. So one of the concerns they have is they don't have enough clinical directors on site, so they have fewer students coming in. But if you had some kind of relationship where students were going into the site for a period of time and then on utilizing telehealth another part of the time, you could expand the numbers significantly.
So is it telehealth you're thinking about, or are you thinking more about ways for the
Just using
students to
Zoom.
connect? Okay.
Remote education,
Right.
because you're thinking about it in terms of the education of the students, not the care of the patient.
Yeah, but when you're doing clinical work, it is telehealth. So if you're learning, I don't know what we should call it, but it is.
Well, maybe we just say
Modern
including
technology.
remote and including by remote means or something.
Yeah, something like that. Yeah.
Okay, so looking at ways to increase the opportunities, also looking at establishing sustainable funding models to pay nurses to serve as preceptors or to support hiring additional nurses to alleviate the pressures on nurse preceptors, so they're not trying to do both their clinical jobs while also supervising. And then develop an action plan for implementing what they come up with, including addressing the need for student housing opportunities. That findings and recommendations of that working group would come back to this committee and others by January 15th.
Okay.
Section 22 is the healthcare employer nursing pipeline and apprenticeship program. This would appropriate $3 million in ARPA funds to VSAC and carry forward for grants to healthcare employers, including hospitals, long-term care facilities, DAs and SSAs, FQHCs, and others, to establish or expand, because some of these already exist, partnerships with Vermont nursing schools to create nursing pipeline or apprenticeship programs, or both, that would train members of their existing staff, including personal care attendants, LNAs, licensed nursing assistants, and licensed practical nurses, to become higher level nursing professionals. And this would, through a combination of scholarship awards, grants from this funding, and health care employers' contributions, it would cover the tuition and fees for the trainees and provide them with assistance in meeting their living costs like housing and childcare while they're attending the program.
So I'm just gonna, just go back, as we're looking through all of this, and there's the director. I think that whomever is calling together the little working group on page 35 should be including AHAC and others who have experience in these areas. They're not, I mean, it's just like.
The Q's, do you want to just add them to the list? Because there's already a list there, right?
Yeah, we can talk about how to do that, and also.
But on page 35, this is looking at nurse preceptor.
It's okay, AHEC does all kinds of summer clinical placement work with prospective healthcare workers. They have an amazing set of programs that are sort of under the radar, so. Anyway. This is just our first walkthrough and for the Kate, go ahead.
Okay, on page 37, in awarding grants under this section, VSAC would give priority to healthcare employer proposals based on certain criteria. So
We're on page 37?
Yeah.
Okay, so when I'm going back to section 22 on page 36, I do think that this is a place where, I know you're gonna get tired of hearing me, I don't care, that AHEC was probably the appropriate organization to work with NVU and others, UVM, so on.
Instead of VSAC?
Would that replace
Yes.
VSAC?
Yeah.
Okay, I need to hear from VSAC as a board member.
So in this section, that these individuals are already in the nursing profession to a certain extent and then are looking to.
They are working in a healthcare setting, so they may be personal care attendants, they may be
Okay,
LPNs, they
so
may be
it's not
LNAs.
just.
Yeah, it's
But
not
they're-
just nurses.
But they're looking to, or this would help them to
Gain
level up.
advanced credentials.
And
Yeah.
VSAC already does an extensive outreach program with junior high kids and walks them right
Yeah.
through high school. And they do all the, loans and financing for, other than federal loans, but private loans and scholarships for like nursing students or, degrees or associate's degrees. So
Right.
I also know that they're getting overloaded with running things, so I'd like to
Yeah.
hear from them before we just take something away.
We'll do that, but I also think that as I'm looking at this, this is more for, there are different opportunities in this whole area.
Could we hear from VHAP too? Because you've talked to them, but
Yeah, no, yes, then look at, this is our first look at this, so yes, we need to do that. Yes, so I just wrote that down, two things.
Okay, so I'm making notes about whether it should be AHEC, we can revisit.
Or in collaboration with.
Somebody knows that. If you have, what would be great, exactly what Senator Hardy said, what would be great is VSAC does some things really well, AHEC does some things really well, put some systematic approach in for those things instead of putting it all in different places, because there are different places in the bill. So that's all I'm thinking about.
Senator Cummings' point about VSAC looking at high schools and middle schools and moving kids through that process seems to make a lot of sense. This seems to be pretty focused on healthcare, where people are already in the profession. And maybe that's the case where.
but they may be somebody that VSAC has a long relation. I don't know why they,
Yeah,
I don't know why they
yeah.
chose them, but it's.
Yeah, I don't know why they chose them either, because my experience with the Area Health Education Center is that it is solely focused on healthcare, whether it's primary care or nurses. And so this is about healthcare. So you want to utilize the experience and the knowledge around healthcare. So that, but it does get down also then to Senator Koenig's question. We know VSAC does some good work with high school students, but we also know that AHEC does some good things with high school students. So it's we'll have to sort that out.
And it may be just because the next section is about forgivable loans and that's VSAC, and so maybe they were just
Yeah, we'll go through that.
hearing from them.
And it might just be that
Loan
VSAC
forgiveness is VSAC.
Yeah,
Yeah.
VSAC is a name people connect with education. AHEC,
Well, education is, it's the area health education centers.
I know, but the general public, I
Oh, the
don't
general
think knows
Yeah.
who AHEC is,
Right.
so.
They don't know
You're
VSAC.
looking
And a lot of this
for
went through the
program.
Commerce Committee. So, I mean, it came from the from the Healthcare Committee, but it went through the Commerce Committee, which I'm more familiar with.
Right,
Yeah.
so,
Understood.
but so as a healthcare committee, I'm more familiar with what's done with healthcare workforce. So I'm concerned that there's a lot of reporting, a lot of assessment, a lot of work that goes on. And we need to make sure that we're not creating something new. That's
So if we can just have them both in here and be, which do you guys want to do, and maybe you do them together, or maybe you take this and you take this.
Or one group refers to the other group when it's their bill.
I still wanna know what it is.
here, I'm gonna pass this around. No, I'm gonna do that now. Let's keep going. Where are
We
we?
have a lot of stuff.
So we're on page 37. I don't know if you want to look at the criteria that they are giving priority to.
Well, let's just look at this.
Keep going.
Yeah.
Okay, so on page 38, they're trying to get awards granted expeditiously so that healthcare employers can start enrolling their staff in programs that start this fall. And it would have an update coming to the Health Reform Oversight Committee by September 15th.
So loan forgiveness, this one would go to, this would be probably a.
So section 23 is codifying an existing program. I believe this is the existing program. They changed a lot of scholarships to forgivable loans. Yes, this codifies and expands an existing nurse scholarship program that was established in 2020 in Act 155. It creates it now as a forgivable loan program administered by the health department in collaboration with VSAC, and that's what we've done with a number of these existing statutory programs like this. It also adds eligibility for students who are pursuing graduate nursing education, which has not been included in the program that was created in 2020.
But
It gives first priority, so this is where I was talking about some of the different levels, gives first priority for forgivable loan funds to students pursuing a practical nursing certificate, so LPN. Second priority for those pursuing an associate's degree to become a registered nurse. Third priority for students pursuing a Bachelor of Science degree in nursing, and fourth to students pursuing graduate nursing education. And they have to agree to work in Vermont for a minimum of 1 year following their licensure for each year of forgivable loan that they receive.
so this is, which section did you just go through?
23.
Yeah, okay.
What's the difference between a forgivable loan and a scholarship?
The scholarship money has to be provided, is paid, yeah, is sort of front loaded. Forgivable loan is the entity making the loan. I think there's a difference.
We don't have
in how
to
they-
put as much cash up front.
I think you don't have to put as much cash up front. And I think the recourse, if somebody doesn't, you don't have to convert a scholarship into a loan. If somebody defaults, it's just a loan that gets collected upon and not forgiven. That's my understanding, although all of that happened, all the change from scholarship to loan forgiveness happened after I was involved.
Right, and loan forgiveness frequently happens when you're practicing, when you're a professional. And then.
Right, well, we have loan repayment coming up too.
Right, that.
But yes, I think,
And loan forgiveness by VSAC would happen before you graduate. Or you could be given a scholarship before you graduate. And then after you graduate and you become a professional working in the field, then the loan repayment becomes a benefit that says, okay, you're gonna keep working in this state for another 3 years and we'll repay your loans. And so there is a difference in the way all of this
right, I think
happens.
loan forgiveness occurs, getting a forgivable loan occurs before you incur the debt, and loan repayment happens after you've incurred the debt.
There you go. And BSAC is good at the former, and AHAC is good at the latter, but say don't be.
Is this in section 25?
So section, hold on. Section 24 repeals an existing educational assistance incentive program for nursing students. So it's kind of replacing an existing program with this new one. Section 25 is the appropriation, and yes, it is 100,000 because they still have a lot of money remaining from prior years appropriations, and it sounds like there is need for it, but my understanding is that there's interest in sort of retaining a place in the budget that reflected this expenditure, so it'll be funded going forward, but it doesn't need the same level of funding that it has needed in past years.
Okay.
I think it's just timing issues. Section 26 creates the Vermont Nursing and Physician Assistant Loan Repayment Program. This again is administered by the Health Department and is in collaboration with VSAC, and it provides loan repayment for nurses and physician assistants who live and work in Vermont and who graduated within the last 5 years.
So this is one where AHAC already does this loan repayment for a number of professionals, healthcare professionals. And there's some language that we'll find in here that I might make recommendations on. So for example, it said, there's a section in here, I'll just do it because I know we don't want to go through the whole thing. But it says that all recipients have to have a certain GPA. And rather than say that, just say that they are, be licensed and ready to work in Vermont. So why go through the GPA analysis? And then, okay,
Page 42.
Yeah.
section two.
somewhere in there.
Question mark. Okay, so
Analyze everybody's GPA.
in this case, excuse me, person has to, as I said, have graduated within the last 5 years, and be a resident of Vermont. So in some of the other ones, they don't have to be a resident of Vermont when they're getting the loan, the forgivable loan, as long as they will work in Vermont when they're done. In this case, they have to live and work in Vermont.
Okay.
And they get 1 year of loan repayment and cancellation for each year of service as a nurse or physician assistant in the state. And then,
Yeah, you know, and it could be that as I think about it, it could be that AHEC has a system in place, but they don't need to administer it. But at least to have some of that system framework that folks can use, because they do have that experience in this area. Similarly with VSAC, where they have experience in their area.
right, I think it'll be important to hear from both of them
Yeah.
about what systems they have, what they would need to create or not need to create if they were asked with one of
Does
these.
this bill have any funding for either of these agencies for the cost of
It would
administration?
probably come out of the
So-
top, and my recollection is it's more expensive to go through VSAC than it is to go through AHEC, but that, we can hear about that. Not my testimony.
Section 27 appropriates 2 million in general fund dollars to the health department for the loan repayment. Section 28 is nurse faculty and forgivable loan and loan repayment program. So this is looking at expanding the nurse faculty workforce.
This is the new faculty, and so my question overall is, why do we need the money for the current faculty? Is there a demonstrated need? We haven't heard that over the past couple of years. What we have heard is we need new faculty. So I can't answer that question.
What I've heard floating around is you can't get faculty because you can make more money being a nurse than being a nurse instructor.
Okay.
And that, so
Okay,
why do it? I think that may.
so that's probably where it
Yeah.
is. Okay, gotcha. We don't want to interrupt the flow.
Yeah.
Okay.
All right, so this creates this program, again, to be administered by the health department in collaboration with VSAC to provide forgivable loans to students who commit to working as nurse educators or nurse faculty at a nursing school in Vermont.
So again,
Also loan
this is loan
repayment.
repayment, this is different.
This is both forgivable loans and loan repayment.
Yeah, okay.
And so for eligibility for a forgivable loan, the person must be enrolled in an eligible school in a program leading to a graduate degree in nursing, demonstrate satisfactory academic progress with a minimum GPA, have used any available gift aid, so other sources of scholarship or other funding, have a contract with VSAC committing them to work as a member of the nurse faculty at a nursing school in this state, and a promissory note. If they fail to complete the period of service, fill out the appropriate forms. And then similar language for loan repayment, graduated from an eligible school within the last 5 years, minimum GPA, work as a member of the nurse faculty, and be a resident of the state. And then in both cases, the service commitment is 1 full year of academic of loan benefit or loan repayment for each year of service as a member of nurse faculty and nursing school in the state. Section 29 appropriates 500,000 in ARPA funds for the forgivable loans and loan repayments for nurse faculty members under that program. In section 30, we're kind of getting out of these scholarship type programs and getting into Green Mountain Care Board work. So this would have in section 30, the Green Mountain Care Board as part of its annual hospital budget review duties, review the hospital's investments in workforce development initiatives, including nursing workforce pipeline collaborations with nursing schools and compensation and other support for nurse preceptors, and also to look at the salaries for the hospital's executive and clinical leadership and the hospital salary spread, including comparing the median salaries to the medians of northern New England states.
So on that Green Mountain Care Board thing, section 30. I might have a suggestion to make there.
You want to look at section 31, which is related as well, specific to
Yeah,
hospital fiscal year 2023.
yeah,
Section 31 says that in hospital fiscal year 2023, which is the one they will be doing the hospital budget review for in the fall of this year, the Green Mountain Care Board may exclude all or a portion of a hospital's investments in nursing workforce development initiatives from any otherwise applicable financial limitations on the hospital's budget or budget growth. And it allows the board to modify hospital budget guidance for that fiscal year as needed.
I mean, it's in May, so they may do it. I was thinking, why don't we let them subtract from their budget the amount they save from utilizing travelers? And so the goal is to reduce expenditures by either getting new nurses and reducing the number of travelers anyway. This is something a good employer might do anyway, so I'm excited about it.
Okay. Section 32 appropriates $1 million in ARPA funds to the Office of Healthcare Reform at AHS to establish and operate a statewide healthcare workforce data center. And it provides some rationale and directs the center to collect healthcare workforce data, collaborate with the Director of Healthcare Reform to identify and propose solutions to data gaps, and share the data with the Green Mountain Care Board as appropriate to inform the board's HRAP work.
I think that, and then you're gonna get sick of me, but DAHEC already has a longitudinal tracking system, so maybe there's some collaboration that goes on here.
So the $1 million seems a lot of money.
Hello.
For a data center, or I mean.
Yes. Yes. That's why I say, I mean, there's stuff always, there's a lot of things going on already. So.
Subsection B says the center,
No, it all sounds good, but I'm putting my finance hat on.
Good.
ARPA funding is one-time funding. And so once we run through it, we're gonna have a nursing scholarship program, and then we're not. We're going
well,
to.
not everything is using
But a lot of it is, you're setting up this database, but who's maintaining it and who's running it after the ARPA is gone?
My point, and so exactly that there are other things happening that that could be piggybacked onto. And if AHEC's already doing a longitudinal tracking system and they have the resources to continue that, open question.
I think this was one of the recommendations from the Healthcare Workforce Strategic Plan, so I'm not sure if they have looked at or consulted who they.
But there's a lot here in addition to incentivizing workforce. That's all.
Well,
But this is not Michael's bill, remember that, this is commerce.
I don't necessarily think this is a bad idea, it's just that's a lot of money. And also, it seems to me like some of this data is probably collected in other places already.
Exactly.
Like Green Mountain Care Boards
Right, so it does say that they should use existing statewide information to the extent practicable.
Okay.
To avoid imposing administrative burdens on providers and avoid duplication of efforts. And it directs the center to expand its data collection practices over 2 years to include all levels of the healthcare workforce, beginning with the highest level licensed healthcare professionals. With some other language about ensuring the center has access to accurate and timely data. And at the bottom of page 50, it creates a permanent classified healthcare workforce data center manager to manage that center.
Yeah, so we're gonna have to end our conversation at this point, but I'm looking ahead, because I went through a lot of this, I went through it all. Section 35, for example, they're asking Green Mountain Care Board for some information to explore and recommend, but do we have SIM grant data already on this? I think we had some data.
I don't know that we have current data.
I don't know what we have, so it would be updating the data. How much does that cost? So there's a lot. And then I like the beehive language.
So Madam Chair, you had asked us about what is not in here.
Yes, ma'am.
I mean, I like most of the stuff about nursing, and clearly we need a focus on nursing, but there's not much of anything substantive for mental health.
Yeah.
Social workers in
Yes.
particular.
That's
There's almost nothing, there's nothing besides that intent language about childcare. And then there's nothing about dental. And I was thinking of your bill that we never got to about dental.
loan repayments and so on.
So those are the 3 areas, sort of social workers / mental health, childcare, and dental.
And distinguishing between, yeah, exactly, I wrote down very similar, mental health social workers, mental health counselors, master's degree mental health, social workers, I mean, so that whole area.
A lot of the mental health counselors are social workers.
Some of them are, and some of them come from different avenues, so some have bachelor's degrees in liberal studies, and then they go on to mental health. The NVU has a great program online right now, and they've got a cohort of students to go through a 3-year program. So it might intersect with what's happening in education, and I haven't done as good homework for that, but.
This bill just came out. I think this is the one. It's a Commerce bill, but Michael just put his whole bill on it. And Commerce hasn't really seen it.
I don't know, I think that was H-159.
Was that
That's
159?
159.
All right.
This came to us from the House.
All right.
Yeah.
And the House
So this
Health
came
Care
out
Committee
on-
did.
so where is Michael's workforce bill?
This is the workforce
This is
bill.
it.
All right, but it hasn't been to economic development?
That's where it is.
That's where it is now.
Okay, so we're
And so
looking at.
there,
first there on March
there are
31st.
sections of the bill that relate to different committees, and committees of jurisdiction in the House actually helped to develop these sections that Jen has drafted.
Okay.
And then it went to Commerce, and Commerce may have changed some things. And now it's in economic development, and we're doing the reverse work. We're-
And it looks like they have taken it up in economic development 9 times already, so I think they are looking at it.
Yeah. And Michael told me that we should hurry up. That's what he told me.
Well, that's too bad. We can go off the air.